Here this afternoon with Darlene. Darlene, tell us a little bit about your situation.
My situation is I was diagnosed with breast cancer in June 2012, and after getting that diagnosis, I decided to have a mastectomy, and after that, I had chemotherapy and radiation.
Gotcha. And then tell us what happened to your bone density after that, after chemotherapy and radiation?
After chemo, when you have breast cancer, they want to put you on an estrogen blocker because cancer loves estrogen. And I think what happens there is the estrogen, affects your bone density. And once that happens, they want you to go for bone density tests annually, and then go see your oncologist.
Mm-hmm. And so your first bone density test after chemo and radiation, what happened?
It decreased, which is normal, but it's not good.
Not desirable.
No, not desirable. Exactly.
Yeah. And the year after that, what happened on your bone density test?
So the first year that I got checked, the oncologist said there was a slight decrease, but we would like for you to go on intravenous for 15 minutes every 6 months for 3 years. After going through chemo, I didn't want to do intravenous anymore, so I passed. She says it's not imperative, but it's something to think about, and we'll see what year 2 looks like.
Great. And then year 2, what did it look like?
Year 2, there was another decrease, and she said we would, if it continues and decreasing, we're going to have to put you on some kind of prescription.
Gotcha. And you didn't want to go on a prescription, of course?
I don't want to go on any prescriptions. If I can do it naturally, that would be the best.
Great. And then your most recent bone density test, which happened last week, what happened?
I was, great news. I was going to see my oncologist, preparing myself mentally for them to say that I'm going to have to go on some kind of prescription that will help with my bone density. When the oncologist came in, he was very pleased that my bone density had stabilized, and in fact it had increased in my spine.
Okay, so stabilized in the hip?
Just stabilized.
Stabilized in the hip and increased in the spine?
Yeah.
Fantastic. What was his reaction?
He was elated. He was like, what are you doing? And keep it up.
Excellent. Now, what did you do between the second and the third year to increase your bone density?
Well, I've been working with Igor, and for 5 years, but when I had the cancer, we took a year and a half off, and when I told him about the bone density, we started concentrating on working on my bone density.
Excellent. And what did the routine look like that was specifically aimed at increasing bone density?
It was dealing with weights with explosive movement.
Excellent. And anything else that we did?
We did hip bumps.
Yep. Show us what hip bumps are.
Hip bumps are when you do the dance, the bump against a cement wall like this.
Yeah. That's right. Great. And it clearly has worked.
Yes.
Do you have any other comments?
No, if this can help any woman, even just one, great.
Fantastic. Do I have your permission to share this with clients, colleagues, audiences, and post this on YouTube and Facebook?
Absolutely.
Fantastic. Thank you very much.
Thank you.